So basically, today's topic is healthcare as an issue at national level. Uh, in essence, if we say health and healthcare are central to primary human existence and well-being, and it contributes extensively towards state's economy and its evolution. मीन्स एसेंस में बात किया जाए तो हेल्थ और हेल्थ केयर जो है वो प्राइमरी ह्यूमन एग्जिस्टेंस के काफ़ी सेंट्रल है. ठीक है, एंड इट्स इम्पॉर्टेंट फॉर द वेल बींग एज वेल. एंड ऑफ कोर्स, since it's an important function and it's an important part of human life, it all exactly contribute very much or extensively towards the state's economy and its evolution. Healthcare services refers to those services that assist in diagnosis, prevention, and treatment of illness and impairments. I think it's a very basic thing. Indian healthcare sector is diversified. As we all know, it's completely diversified. We don't only relate to the Ayurveda treatment or homeopathy when we feel ill. We also look for Unani, neuropathy, acupuncture, etc. So, Indian healthcare sector is diversified and it is a home to various medicine practices. Example, as I said, it's Ayurveda, allopathy, homeopathy, then Unani, then we have naturopathy and acupuncture as well. And national level issues in the healthcare sector, which is very important and foremost thing which you have to understand. So there were two cases. In the first case, it's State of Punjab versus Mahindra Singh Chawla. In this case, it was said by the apex court, or you can say that the observation done by apex court was right to health is an integral and fundamental part of the right to life, and the government has a constitutional obligation to provide healthcare facility. Then there was a second case which was of State of Punjab versus R.L. Bagga. In this case also, court further endorsed that it is the state's obligation to maintain health services in the nation. Being the world's second most populous country after China, China is the, as you know, all know that China is the most populous country. India comes at second, and being the world's second most populous country and one of the fastest growing economy, India faces unique and unprecedented challenges in the sphere of public health. Part 4 of Directive Principle of State Policy states that, as we all know, DPSP is persuasive in nature and it doesn't impose any obligation, or there is no compulsory obligation on the state. So no person can claim against the non-fulfillment of these non-justifiable directions. Then part 3 of the Indian Constitution, right to health, is not an explicit fundamental right under part 3 of the Constitution. It's not explicit. It has to be interpreted under right to life, which is guaranteed under Article 21 of the Constitution. Then in addition to this, government public hospitals in India lack basic and advanced amenities. We do not have a trained doctors, or we can say the public health sectors or government hospitals do not have trained doctors, equipments as well. And you all might have observed that in the recent COVID-19 pandemic infections, in that infection scenario where which caused a high amount of unreasonable conditions, and there was an inability of the state government for having prepared responses to this outbreak. So that was the only thing about issues at national level in healthcare. The other topic would be healthcare as an issue at international level, where we're going to study about WHO and TRIPS and many more.